Good evening, everyone. I am Masima Al-Ghaibi, a hygienist and a lecturer at King's University. Currently, I am a PhD student at the University of Iowa. I'd like to start off by saying that I'm beyond happy that this SDHS conference is happening now. And I would like to remind you that evaluations for each presenter will be at the top of the screen towards the end of their presentation. Your comments are very valued. So I would like to present Dr. Enass Shamsy, our first speaker, and her topic will be society awareness of the dental hygiene profession. Dr. Shamsy is a DDS from the University of Aleppo, and she has a master's in conservative dentistry and endodontics. She is also currently the head of the dental health care department at Enass Medical Colleges, Riyadh. She also has past experience in clinical practice, and she is also a lecturer and has been published in recognized journals such as the International Journal of Dental Research and the Journal of Contemporary Dental Practice. So without further ado, Dr. Enass, go ahead, please.
Good evening, everyone. Shall I share my screen now?
You can go ahead and share.
Okay. So is it clear now? Slides are appearing?
Go ahead.
Okay. So good evening, everyone. First of all, I would like to thank the organizing committee for giving me the opportunity to present in the first SDHS International Online Conference. My presentation today will be about the Saudi society awareness of the dental hygiene profession. Before starting the presentation, I would like to share with you my story with dental hygiene. My journey with dentistry started in 2003 at Aleppo University College of Dentistry, where I completed my undergraduate and postgraduate studies. My story with dental hygiene started 3 years ago when I applied for a job position at Enass Medical College. At that time, I thought that I am applying for a dental college. I was not aware that it is a dental hygiene program. And I was really surprised when I figured it out, because unfortunately, I never heard about this specialty previously. And when I started to do my search to understand what is dental hygiene specialty, I was more surprised to know that it does exist in KSA since years ago. But neither me nor all of my relatives, friends, or community did know about it. And when I got more close to this specialty, I realized how important it is and how much it is underestimated in our communities. So the idea of this presentation was based on, let's say, curiosity or inquiry that I felt towards this specialty. And the study that was conducted was just a preliminary study, which was done in an attempt to assess Saudi society awareness for this profession, and we will know more about it during the presentation. So at the beginning, let me give you a brief history of the dental hygiene specialty. This specialty started in the late 1880s when dental nurses were working in the dental practice. Then the dental hygiene specialty was born when Dr. Alfred Fons decided to train his assistant, Irene Newman, to provide some prophylaxis procedures such as scaling. Then in 1910, sorry for that, I want the pointer. Yes. So in 1910, the Ohio College of Dental Surgery offered a formal course for dental nurses. But unfortunately, this course was opposed by dentists, and these dental nurses never get licensed. Then Dr. Fons started to train 97 dental hygiene students in 3 classes. And these 97 students got licensed in 1917, and the dental hygiene practice was born. Actually, Dr. Fons preferred the dental hygienist term, or uh, to call the dental hygiene practice rather than the dental nurse, because of his commitment to providing preventive interventions and teaching children oral hygiene for prevention of dental diseases. Then in 1923, the American Dental Hygiene Association was established. So the term dental hygiene care represents all integrated preventive, educational, and treatment services administered for a patient by a dental hygienist. And dental hygiene is defined as the science and practice of the recognition, treatment, and prevention of oral diseases. In 1987, the American Dental Hygiene Association sponsored a conference. This conference aimed at expanding roles of the dental hygienist as a member of the healthcare team rather than solely as a member in the oral healthcare team. So in 1988, the outcomes of that conference were published, and the document opened in the preface by stating, all occupations have an obligation to society periodically to assess their value and relevance to society and take whatever actions are indicated to fulfill their societal contract. In the literature review part, I will first talk about the dental hygiene history in Saudi Arabia. So in 1975, the first dental college in Saudi Arabia and in the Arabic Gulf area was established at King Saud University. And in 1981, the Saudi Dental Society was established. The first dental hygiene program to be established was in College of Applied Medical Sciences at King Saud University. And in 2017, there was a representative sample of dental hygienists in Saudi Arabia, which were surveyed, and they supported the establishment of a professional association and feel that it would advocate for dental hygienists. So in 2018-2019, the Saudi Dental Hygiene Society was established, fortunately. Currently, there are 6 programs of dental hygiene in the universities of Saudi Arabia, which are being taught in Riyadh Ilm University, Prince Sultan Military College of Health Sciences, King Saud University, King Abdulaziz University, Inaya Medical College, and Al Baha University. In this part, I will present for you some of the studies that were conducted in order to assess the awareness towards dental hygiene professions. The first study was in Wales, UK, where general dental practitioners were surveyed in order to examine their attitude towards employing dental hygienist therapists. was found that dentists had clearly a lack of knowledge in terms of the role they can play within the team, the role that the hygienist therapist can play within the dental team. Some practitioners had a negative outlook towards hygienists because they lack the confidence and ability to take charge and work as part of team. This is according to the surveyed dentists. Also, the general dental practitioners demonstrated a clear lack of knowledge in relation to the cost effectiveness of adopting hygienist therapists in general practice. In another study conducted in India, general dental practitioners' knowledge and attitude towards employing dental hygienist or surgery assistant was evaluated. Only 6.2% subjects were aware that dental hygienist or surgery assistant may work outside the direct supervision of a dentist. And more than 84% subjects thought the direct supervision of a dentist on the dental hygienist was necessary, and 9.7 subjects did not know. More than half of about 51.3% subjects thought that dental hygienist or surgery assistant cannot perform high quality of work, and 9.7% subjects didn't know. About 1 in 2 dentists have positive approach to team working with dental hygienist surgery assistant. And there has been very little research into patients' attitudes toward dental hygienist surgery assistant, and that's the reason that led us to conduct this research. Also, most of the dentists in that study believe that dental practitioners can perform high quality of work using the dental hygienist or surgery assistant in team approach, but they were not able to employ them due to financial problems, patient acceptance, and some extent availability. So historically, efforts to expand dental hygienist scope of practice have faced opposition from dentists. Currently, the scope of practice for dental hygienists varies widely by country and in some countries by state, region, or province. In a study conducted in Ontario, Canada, to assess the attitudes to independent dental hygiene practice. And this study was conducted in 2004, where dental hygienists started to claim for the right to work independently. So there was an agreement among dentists and dental hygienists that the dental hygienists should allow to practice independently of dentists. Also, dental hygiene training should be offered in universities. There was an agreement among that, and baccalaureate education of dental hygienists will make them better workers. The finding of this survey suggests a great deal of unity in attitudes about independent dental hygiene practice among dentists and a fair amount within the dental hygiene profession. Dental hygiene profession were not confident of this step yet. In a study conducted in 2018 in Michigan, general dentist perceptions of dental hygienist professional role. This study aimed to assess perceptions and knowledge of general dentists concerning the legally allowable duties of dental hygienists in their state versus the services they provide in their individual practices, the importance of dental hygienist contributions to the practice, and how well dental hygienist interacts with dentists and patients. The average number of services dental hygienists provided in the practices surveyed were lower than the average number of services that dental hygienists are legally permitted to provide in the state of Michigan. And that was really surprising and impressive. The higher the importance dentists placed on dental hygienist clinical and overall contributions, the more diagnostic services and therapies the dental hygienist perform. And the older the dentist were, the higher they rated the importance of dental hygienist clinical contributions. So the study objective was to assess society awareness of the dental hygiene profession in Saudi Arabia. The materials and methods of this study. Study design was cross-sectional. The sample consisted of 402 male and female Saudi subjects. Sampling method was the snowball anonymous link recruitment. It was distributed via WhatsApp. The study tool was a questionnaire. This questionnaire consisted of two parts. The first part was about general information or demographic information. The second part was questions related to Saudi society awareness of dental hygiene profession. Further statistical analysis was done using the SPSS. Chi-square test was done with significance level of 5%. I would like to highlight that the language of the questionnaire was Arabic because the targeted sample, which represents the study population, does not necessarily know English, so we wanted to make it more understandable and easier for them. The results. The first part of the results was the general information or the demographic part. So about a third of the sample were male and 2/3 of the sample were female. The age groups, most age group participated in this survey were more than 30 years old. The degree, the bachelor degree holder were the most among the sample of the survey. Here I will present the 5 main questions that were included in this survey. The first question was, did you hear about the dental hygiene profession previously? For this question, half of the sample replied or responded by yes, and half responded by no. They have not heard about the dental hygiene profession previously. The second question was, can dental hygienist replace the dentist? Almost half of the sample responded that they don't know if the dental hygienist can replace the dentist or no. 40% replied no, and only 12.2% responded by yes. Is visiting a dental hygiene clinic replaces visiting a dental clinic? Almost half of the sample responded to this question by no, but 38% responded by I don't know, and 15% responded by yes. Does the dental hygienist work in a separate clinic? Almost half of the sample responded that they don't know, and the rest of the sample was divided equally to yes or no. What procedures does the dental hygienist perform? 40% replied with treatment of simple caries, 50% tooth extraction, 59% fluoride application, 42 for pits and fissure sealant application, 56 for polishing teeth and restorations, 67 for scaling teeth, 51 for in-clinic bleaching, 33.8 for home bleaching, and 61.7 for taking teeth impressions. So when we tested these questions to see if there was a significant difference among the groups of the participants, for the first question, did you hear about the dental hygiene profession previously? There was a significant difference in the groups when we compared the gender. but there was no any significant difference when we compared the study degree and the age. And the same applies for all the three other questions. Can dental hygienist replace the dentist? It was statistically significant for the age, but not for the study degree or for the, I'm sorry, it was significantly different. The difference was significant for the gender, but not for the degree holding or for the age. The same for is visiting a dental hygiene clinic replaces visiting a dental clinic. And for the last question, does dental hygienist work in a separate clinic? So for the discussion, for all the presented results, there was a statistically significant difference between males and females, as females were more aware of the dental hygienist role. This can be explained by that the more number of females are dental hygienists and less are the males. And I think that this agrees with the survey that Ms. Fatoun Al Khalifa has presented on the first day of the conference. The female were working as dental hygienists more than males. So I think that this may cause that the females were more aware because they might have a friend or a relative as a dental hygienist, so they were able to recognize this profession more. Although bachelor degree, yes, I'm about to finish.
Yeah,
I know I have 5 minutes, I know.
Thank you.
Yes, all the bachelor degree holders were more aware. The difference was not statistically significant, and subjects above 30 years had more knowledge than other age groups, but the results were not statistically significant as well. The highest percentages of the non-procedures carried out by the dental hygienist were scaling teeth, taking impressions, fluoride application, polishing teeth and restorations, and in-clinic bleaching, respectively. The highest procedure was scaling teeth, but only 67.6% replied or responded by yes, is dental hygienist responsible for doing scaling. And the lowest was tooth extraction. Only 15.4 said that yes, a dental hygienist can do tooth extraction. This lack of knowledge concerning dental hygienists' full scope of practice indicates a need for change. In conclusion, there is lack of knowledge about the dental hygienist role as a healthcare practitioner among Saudi society. However, the literature has now published studies about this subject or this topic. So further studies are required in order to assess patients' attitude toward dental hygienists in Saudi Arabia, assess the dentist attitude toward dental hygienists in Saudi Arabia, assess employers' attitude as well, because in other countries, there is a lot of employing issues. As I said in the previous studies, cost effectiveness played a huge role in employing dental hygienists in a dental practice or not. Assess the dental hygienist knowledge of their scope of practice, because I recognize that among my students, they don't know the scope of their practice, and that was really sad. So my recommendations in the conclusion of this presentation is establishing a scope of practice for professional dental hygienists in Saudi Arabia. And we rely on the Saudi Dental Hygiene Society for taking the responsibility of doing that. Activating the role of dental hygienist as oral health educator in community-based educational programs. And this is hugely important because dental hygienists are educators as well as clinicians. Dental school programs should explore strategies to ensure that graduates are educated about dental hygienist scope of practice in order to work with them effectively, because if dentists are aware of the role of the dental hygienist, it will be more recognized among the society. I personally believe that the role of the dental hygienist is much beyond scaling. The dental hygienist plays a vital role in maintaining oral and dental health. And I totally agree with Dr. Tim Donnelly in his presentation yesterday when he stated that the dental hygienist is the most dental practitioner that the patient is supposed to see. And this is the end of my presentation. If you have any questions, I will be happy to answer. And thank you. Thank you for listening.
Thank you, Dr. Enass, for this great presentation. And I think what you presented is really needed because we don't have much information about programs in Saudi Arabia. I just would like to add before we look at the questions that there are two programs that may have been missed. We have Al Qasim University Bachelor's Program, and we also have King Faisal University Diploma Program.
Actually, I relied on the website of the Saudi Dental Hygiene Society as a reference on this.
Yeah, I understand.
It's
really hard to find information about the programs in Saudi. So
I documented my. I found a lot of difficulties in knowing how many programs, because there were some programs that were deactivated.
Yes.
So I didn't know if they are active now or no.
Very true. Very true.
Yes.
But I just like to add so people who are attending can know.
Yes.
And if anyone has any questions, please write in the chat so we can have Dr.
And actually, I have also another misinformation that I really tried to find out, but I was not able to find it out. When was the dental hygiene program in King Saud University established? In which year? In the College of Applied Medical Sciences.
It was established in the 80s, and I have to say, but not perfectly sure, 83.
Yeah.
But sometimes the program was on and off.
Yes, so I need that year as well. I need to add it to my literature review. Thank you so much, Ms. Dima, for the information.
Great, beautiful presentation. And please, anyone that has a question, right, do not forget to give us your comments. The presenter evaluation survey is at the top of the screen. And we just have a few minutes, and then we can start with the next presentation. So we'll give you a few minutes. I'm not seeing any questions, but people are writing, so maybe we will have a few questions.
And I used what Ms. Mayada was presenting in the last lecture.
Yes, I understand.
Yes.
Maybe we have any questions. We'll be waiting while we still have a few minutes. We have a question here from Mr. Ayub Tubal. Any barriers for this gap? He's asking.
Which gap?
Like, I think he means the gap in the literature that you meant, that you referred to.
I did not understand the question.
Mr. Ayub, clarify.
Can he specify?
Right. Yes, he's going to specify. Gap in knowledge of the profession. Do you think there's any barriers due to this?
I think we need more studies to identify the factors why society is not aware of this specialty. But I think mostly because the role of dental hygienist is not activated positively and effectively in the dental practice. I think this is why. We are lacking dental hygiene clinics. I think this is hugely important.
Yeah, very true. We need hygienists all over Saudi Arabia.
Yes, yes. And there are plenty of them. But
Yes.
their role is really underestimated. So this is why they have to stand up and take their role.
Okay, maybe time for one more question. If we see a question, we'll take it. I'm just waiting one more minute.
Okay.
Could you please stop sharing your screen?
Yes. Okay.
We have a comment for you that is this research published, and did you consider publishing it?
No, it's not published yet, but yes, I am working on the manuscript and I hope to publish it in the near future.
Perfect. Thank you so much for your support, Dr. Enass. And on behalf of the Saudi Dental Hygiene Society, I would like to present this certificate of appreciation for your valuable presentation and contribution. Thank you for your time.
Thank you so much, and thank you again for giving me this opportunity.
Great. Thank you.
Okay, we have an information here. First graduation of dental hygiene, King Saud University, around 19. Yes, I want the exact date.
We're going to go
Exact
to
year.
the presenter, Dr. Enass, but we can comment on anything in the chat.
Okay.
Thank you.
Thank you so much. Bye bye.